of the issues that we in the Progressive Caucus have to deal with is the L in DFL. Because organized labor is not necessarily on the side of what we might think of as the angels. And I'm curious how you see organized labor in terms of support. I mean, I'm certain it does not speak with one voice, but I'm curious with how many voices you do see in organized
Sure.
labor about your bill.
It's a very good question because labor is a very tricky thing to deal with it. The biggest thing we've had going for us, there's a national labor for single payer movement, and the nurses, Minnesota nurses, as a member of AFL-CIO, have been pushing this very aggressively. Very aggressively. They got through AFL-CIO state convention last year at a resolution endorsing a Minnesota health plan by the AFL-CIO. So they're officially on board, supportive of it. Some of the building trades are some of the more cautious ones because we've got our own plans and they're very good plans. They're excellent plans, better than anybody else's, which is a little bit overstatement, a lot overstatement perhaps. And they're spending, like carpenters, I think, say that for every hour they work, $10 is going into their health plan. That's a lot of money. It's very expensive. It's not the best system, but they're worried that it is. And a lot of the labor folks who are for single payer are trying to explain to them two things. One of which is, this is a downhill spiral. You're spending all your effort negotiating for that. You earn $1 more on wages, you lose $1.50 in healthcare benefits. So all of labor is negotiating. This is a hassle they shouldn't want any more than the employer should want. And it's a fight, it's so expensive, and so they shouldn't want it. The other thing I'd make a pitch for, and this is the values. I'm sorry I went to get a drink and go to the restroom while you were speaking, so I missed it. But I did hear you talking about the values. And the values, what is, if you had one word to describe labor, if I had one word, I'd use the word solidarity. We're in this together. We're in it for union brothers and sisters are in this together. And there are some folks in the labor movement, well, we want it for us, not for those non-folks. Well, that's a fairly small club in modern American history. Solidarity means we're in this standing together. The labor movement brought us the weekends, the 40-hour work week, they brought us minimum wage, OSHA, they brought us all sorts of things we value. And these didn't just apply to labor members, they applied to everyone. And frankly, every labor member has family members who are not covered by their health plans, and most labor unions don't have great health plans. Even Minnesota nurses, which it's an incredible union, they insist on making their health care benefits 100% employer paid. They cover all their benefits. They had a fight with Alina system 2 years ago, you may recall, over the benefits because Alina wanted to take some of that away. But they've given a lot of wages up in order to keep that because they want to make a statement of that. And here Alina, in my mind, is no better than Hobby Lobby. Remember Hobby Lobby saying, we don't want you employees to get this kind of benefit. It was women's reproductive health issues. But where is Alina better than that when they're trying to divide their own employees to fight the nurses who are trying to hang on to a better health care system? So labor should be 100% on board. It's clearly in workers' interest to be on board. There's some who are convinced it's not. They're coming there largely because there's so many very passionate union members who are fighting hard for it. And in Minnesota, the nurses are far and away the strongest.